I'm here with Molyn Leszcz, and Molyn, we are really looking forward to having you to Austin to facilitate our two-day conference, focusing on developing and sustaining successful group leadership. I remember the last time you were in Austin, which was 12 years ago, and I wonder what your experience was like with the Austin community and how you feel about being our first two-day conference presenter.
Well, thank you, Stacy, for doing the interview. And let me say that I'm very excited about coming back to Austin. Hard to believe it was 12 years ago, but I was very impressed with the Austin community, the way in which people work together as a community of practice and support one another's professional development. I made some very valuable contacts with people then that have continued through this past 12 years. I see people regularly at AGPA, and I'm excited to be coming back to Austin. And, as a Canadian, I didn't really have a full appreciation for how Austin is within Texas. And I was really impressed and very glad to be invited back and to be the first presenter in the two-day format. I feel quite honored.
Oh, great. Well, yes, we're very excited to have you. So just so that those in the community who don't know much about you get a chance to hear a little bit, what drew you to group psychotherapy, and can you tell us a little bit about where this interest has brought you in your career?
Sure. Well, group therapy has been part of my academic career since I finished my training in psychiatry. I had the great good fortune of doing a post-residency fellowship with Irv Yalom at Stanford University. And really that was the beginning of a long focus on group psychotherapy. I loved working with Irv. We continue to work together on various projects, and soon we'll be working on the 6th edition of the Theory and Practice of Group Psychotherapy.
Oh, wow.
And throughout my work, I've been at the University of Toronto for the last, since 1981. And my work is always centered on psychotherapy and group psychotherapy in particular. It's what I teach, it's what I supervise, it's what I write about. It's the research that I do, and I've been able to utilize group therapy in a range of different clinical settings, from people with substance abuse to first episode psychosis, to women with metastatic breast cancer, to inpatient groups in an acute mental health setting, to geriatric depression. And I find that the fundamentals of group work are useful and valuable in each clinical application, in each clinical modification. And for the last 12 years, I've been the chief of psychiatry at one of the University of Toronto teaching hospitals, Mount Sinai Hospital, and I've also served as the university vice chair, and I was chair for 1 year. So being a group therapist is incredibly valuable when you're doing administrative work, because you understand process and you understand what the meaning is of the voice that is dissonant and that there's a part of you that would like to say, stop saying what you're saying, but you recognize that person's bringing an important truth into the larger group that needs to be engaged. So it's been incredibly important to me and incredibly helpful. And I'm glad now that I'm going to be working again on the next edition of the group therapy textbook to be able to hone my focus again in that area.
Okay, wonderful. So in some of the writings that I had the opportunity to read, you note the power of a skilled group psychotherapist to enable new relational experiences. And you refer to this as passing the transference test. Can you explain a little bit about how a therapist might recognize and pass the test when it arises in group, and how it can lead to an emotionally corrective experience?
Sure. Well, let me say that when I worked with Irv Yalom on the 5th edition of the textbook, and really went back into the literature, the research literature, and I found that there was virtually nothing that had not been articulated in earlier editions that didn't stand the test of time. So this is not so much coming up with new models as much as it is articulating ways in which we can be sure that we are part of our patient's solution and not part of our patient's problem. Our patients come into treatment seeking opportunities for growth and for development that involve recognition and understanding of two things. One are the pathogenic beliefs that obstruct growth and development. Those take shape early in life often, and the second is the way in which those are expressed in relational and interpersonal terms. And groups are fantastic vehicles for the illumination of that sequence, the beliefs and the behavior, and the way in which they come alive in group therapy in a way that I find much more relevant than relying only on a patient's narrative. Being able to rely on how the patient is, or how the group member is with others, the way in which they might be different with an older member of a group, a younger member of a group, an attractive member of the opposite sex, adds richness. Once we illuminate this, then the task is to try to help facilitate growth and development, which means disconfirming pathogenic beliefs and interrupting the negative loop that often arises when relational patterns emerge from those beliefs. So that's really the essence of what I find to be helpful about group therapy. In order for us to do that, if we want people to bring themselves as they genuinely are into the group, we have to have strong alliances with each member. We have to have strongly cohesive groups. Because we don't want people to be on their best behavior. We want people to be as they genuinely are.
Okay. Well, thank you. So as the therapist, when you it sounds like your part of your job is to change the story or to create a different outcome for the client than what they were used to in their relationships. And I wonder if you could just tell us a little bit about that process for yourself.
Well, it begins with developing a collaboration. So nothing happens without there first being a strong alliance where the patient, and I'll use the word patient, but we can interchange that with client or group member.
Sure.
And the provider first must reach agreement about what are the goals of treatment, what are the tasks of treatment, and what's the quality of the relationship that we need to have in order to be able to do the work of therapy to achieve the goals of treatment. It gets more complicated in a group because there are forces that we don't have full control over, and the complexity of the relationships make it more challenging, but also more enriching. And so I see that as that it's a collaboration. So it's not that we author a different course. It's that we remove obstacles for our group members so that they can author a course for themselves in the relationships within the group and then outside of the group, a course that is more compatible with what they actually wish for. That means overcoming shame, overcoming fear, overcoming the reluctance to be vulnerable, and entering into a more reciprocal and mutual way of relating. Many of the people who seek group therapy don't have innate experiences in which groups have been part of the solution. Groups have often been part of the problem. Never belonging, socially anxious, having been bullied, feeling that they don't make the cut, that there's some kind of deficiency or defect, or they have huge blind spots, and they think I'm a nice guy, I'm a good woman. Why am I not able to have more satisfaction in my life? So that's part of how I would answer that question, Stacy.
Okay. Yeah. Thank you. So one thing that I have noticed in your writing is that you encourage therapists to encourage client protests. And I wonder what you mean by that, and how we can encourage protest while maintaining our leadership role.
Well, I think we maintain leadership by virtue of encouraging protest, because we want our patients to bring themselves genuinely into the therapeutic arena. And that means letting us know what's working, what's not working. I recognize that we're always dealing with an intersubjectivity. There isn't a single objective truth by and large. But if a member of a group says to me, or says to the group, this doesn't make me feel good, then I look at that as an incredible therapeutic opportunity to understand what it is that's causing distress, and to see whether the change, or it comes on both sides of the interpersonal equation, or perhaps it's the first time somebody's able to protest and feel that they are being recognized and heard. The genuineness, the authenticity with which people bring themselves into the treatment is key. I place a great deal of value on people offering genuine endorsement and expressions of gratitude as well. So it's not just the protest, it's bringing the entirety of one's experience into the therapeutic arena.
Okay, so it sounds like you encourage people's reactions to you and to one another to come out in genuine ways, whether they're protest or something more filial.
Exactly.
Okay, great. So speaking of protest, we've all experienced clients who make provocative, hurtful, and off-putting statements to us or to other group members. Can you describe your internal experience of this kind of tense group conflict, and how you stay focused on not getting hooked when you're in the moment?
I think getting hooked is not the problem.
Okay.
I think, in fact, I appreciate it when a patient kind of gets a little bit under my skin, or under the skin of others in the room, because it generates some chemistry. The trick is to not stay hooked, but to recognize what is this person's interpersonal message. What is this person's interpersonal impact? Why are they doing what they are doing? How can I understand it in a way that furthers the treatment? If I'm feeling really annoyed or hurt or shamed, then it often is saying something important about the experience of the person who's engaged with me or engaged with others. So I said earlier, things are intersubjective. We all bring our stuff to the interaction, and I've had patients in my groups that, but the groups that I lead in the hospital are often observed by trainees, and I've had situations where trainees have said they wanted to jump through the window and attack a member of the group for their arrogance, for their dismissiveness, for the destructiveness to others. And they said, how do you stay calm? And so my response is that it's not that I don't get annoyed or angry, but I don't act from a position of anger. I will look at that as an opportunity for some therapeutic meta-communication, processing the experience. When a person in a group, for example, takes a stridently anti-cohesive approach to the group and devalues and dismisses the work and devalues and dismisses other people in the group, but yet that person continues to come to the group, that's a therapeutic opportunity. And the person is testing something about the safety of the environment, about the ability of the environment to tolerate a non-compliance. And I see that often has an incredible therapeutic opportunity. It's often challenging to be an advocate for the antagonist, but the antagonist has a truth that needs to be understood and engaged. Again, for me, it pivots on the fact that people come. As long as people are coming, we can work with them.
Okay. So it sounds like you stay in your therapeutic self and notice all of the feelings that arise for you without acting on them unless it's for the benefit of the client.
Yeah. I think the adage that I found helpful is that we want our patients to strike when their iron is hot. I don't think therapists should strike when their iron is hot.
Okay.
We need to metabolize our countertransference. We need to distinguish between the countertransference that is elicited by the patient in a way that's fairly objective, and most people would feel a similar way. We need to distinguish that from subjective countertransference, is what I bring into the office that particular day, or what I bring in as part of my nature, part of my character, part of my life experience. So countertransference is incredibly important data. I supervise residents in psychiatry and group therapy, and typically will supervise 3 or 4 or 5 co-therapy teams over the course of an academic year. And their success is often tied to their comfort in being able to talk about countertransference. Because if you understand countertransference and can work with it, then it improves your capacity to be a therapeutic agent. One of the things that I believe very strongly is that the psychotherapies generally are equivalent, the group therapies are generally equivalent, but there's tremendous variability in the effectiveness of group therapists and individual therapists. And if we want our field to be taken as seriously as other parts of healthcare, then we have a responsibility to ensure that people are getting the best care. And that requires a deliberate focus on training, on supervision, on observed practice, so that each of us is the best version of ourselves as a treater. In the same way that we would, if you have to have surgery, if you're getting whatever you're getting done, you want to go to see the surgeon who has the best record with regard to good outcomes, low infection rates, quick return to function. We should have the same standards in mental health, that therapists should all be working in a way that reflects the things that we know that make people effective as leaders.
Okay, and you say one of the main keys to that is our ability to work with our countertransference, both the objective and the subjective.
Yeah, exactly. So both are keys in maintaining an empathic connection to our patients. Okay,
great. Well, thinking about bringing you in Austin, we're going to be having we're going to be learning from you, and we're also going to be having some experiences with you. And one of those experiences will take place in a demo group. And I wonder, when we think about what you've said about group cohesion and empathy as keys to a successful group treatment, along with what you're talking about with analyzing your countertransference reactions, how might we see this show up in a demo group with you?
Well, I hope you'll see it show up. I hope that there'll be a connection between what I speak about and how I operate in the group. Demonstration groups are always Right? It's like a box of chocolates. You never know what you're going to get.
That's true.
And I've done demonstration groups many times in different affiliates, different meetings, and it's always something that I learn a great deal from. So in addition to your comment about what people will learn from me, I'm expecting that I'm going to learn a lot. And one of the things that I believe is that in order for us to grow, we have to be observed. We have to get feedback on what we do. We have to be able to account for why we're doing what we're doing. The concept of deliberate practice, I think, is key. So I'm hoping that I will be consistent with that, and that people who are observing will benefit, and the people who are participating will benefit, and I'll benefit. So I think if we're all aligned on those fronts, I think it'll be a good experience.
Okay. So part of the structure of this particular conference includes interactions between you and the therapist who will be leading small groups.
Correct.
With us. And I wonder what you hope to impart to them regarding how to provide the most effective experiences for their small groups.
Well, I begin, I think, by recognizing that the people who are leading the small groups, the experiential training opportunities, are, in my experience, excellent group leaders.
Okay.
And but themes will emerge through the presentation, through the demonstration group, through our embeddedness in a larger society that will weave their way through the experiential groups. So when I talked earlier about a community of practice, what a community of practice provides is an opportunity for reflective space. So what I'm hoping that I would provide in meeting with the group leaders is an environment that promotes reflective space, so that we can understand what's happening in the small groups and how that relates to the theme of the meeting and perhaps society at large.
Okay, thank you. So I know this is a big question, but what do you most hope the group therapists who come to attend your training learn or experience during these 2 days?
I would hope that people will come away feeling heartened about doing the work. It's difficult work. It's important work. And if people feel reinforced and supported and encouraged in what they do, that will be good. If they learn something that allows them to expand their therapeutic repertoire, or how to sometimes it's a matter of doubling down on something you already know to be effective, but may encounter resistance. I think those would be good objectives for me. I would be happy if people felt it was worthwhile and that they came away feeling that they had gained something or contributed something to other people's learning and knowledge.
Okay, I appreciate that. So that's all of the questions that I've had for you, but I wonder if there's anything I haven't asked about that you might think we should know about your work, or what it looks like to create a successful and effective group psychotherapy practice.
I don't know that I have much more to say about that in a specific way, because the way in which we practice is different from community to community. It's certainly different as a psychiatrist in Canada than it would be in the States, because of the way in which we are funded. And we have, Canada has pretty close to universal health care. So not to say that mental health care is easy and everyone has access to it, but people can access care without concern about the cost necessarily. And there are advantages to that, and there are some disadvantages to that. And sometimes there's long waits, but the economics of healthcare are less concerning for most Canadians than they are for most Americans.
Okay.
On my conversations with my American friends and colleagues.
Okay.
And I'm going to try to stay away from stuff that might be politically controversial.
Good luck.
Good luck, indeed. But
Yeah.
that's another area, in fact, where I'm half joking when I said that.
Mm-hmm.
I think that we, people who work with groups and understand group dynamics and understand group process, can be an enormous resource to our communities and to the societies in which we live, because we can see things that others don't see because they're in an intensely reactive frame of mind. And we can find ways, I think, to promote a more a safe environment rather than a polarizing and fragmenting one.
Okay. Well, we certainly need that here in Texas.
Well, I think there's no place that doesn't need it.
Yes, that's true. All right. Well, thank you so much for your time. I'm going to turn off the recording and then just...
Okay. Stacy, thank you so much for doing the interview with me. I've enjoyed it. You've been a terrific interviewer.
Oh, thank you. Thank you. We really look forward to seeing you here in October.
Great, great, great.